Doctor, how are you?
Fine.
Welcome, doctor. Yeah, I can hear you, doctor. I must want to introduce you to my team here. We are sitting with a team of people here. We have to start with Kavita Maheshwari. She's joined in from Bangalore to help me coordinate this show. We have Ravi
Hello, doctor.
Hello, doctor.
Hi.
Ravi Parasrampuria, and then we have Mr. Hemant. Hemant, are you there? Okay, Mr. Hemant Chavria. I can't hear you, Hemant. He's mute actually. So we have this small team. We together make each show work, because doing one show every day. We've been doing one show every day since 17th of April, and having about 7 doctors, and every time there's a new topic. So it's not easy. So we need to do a lot of back office work and trying to study the topic, how to take it forward. Okay.
Taking the full advantage of distancing.
Yeah. Can we admit that? Monica, we are live. I'm admitting that. Hi guys, Manish, how are you? Hi Meenal, thank you for this appreciation in the morning. Thank you, your call really mattered. Thank you. Thank you, Ramneek. Okay, let's start. Ladies and gentlemen, boys and girls, a warm welcome to Papa JC Talk Show. So far, we have covered 16 different topics. Out of them, 7 were addressed by eminent doctors. We also had sessions on nutrition, video making, dancing, cocktail and mocktail making, home remedies, art of taking selfie, DJing, and meditation. And these 7 doctors, they were all there with 7 different topics and very interesting ones. I think a lot of people had lots to take away. I know some people have been maintaining books like this to note down what they are learning every day. Okay. We also had a recent fun session with 5 doctors on board. And that show was hosted by none other than my favorite radio man, Jimmy Tangri. It's a session to talk about. My only suggestion is, if you missed out on any of them, please follow me on the Facebook page, which has all these recordings, so you can see them, each one on them. And each doctor is talking about their interesting subjects. So you'll have some information that you might have missed out, otherwise you can get them from there. Tomorrow we have invited Dr. Ajay Arya to talk about all ENT issues. But for tomorrow, the show time has been fixed at 6 p.m. instead of 2 or 12 or 11. So it's 6 p.m. for tomorrow. So please join in again, because ENT is again a very important subject where we're going to talk about issues related to sinus, ear, nose, trunk. Okay. The issue is that now we are protecting our passwords, and we are issuing links every day. We are having a new link for a meeting every day. We are not having any common links. So make sure that you get your links beforehand. We have this WhatsApp group where we share the link every day. Besides, in case you miss out, please message me your number. I can add you to the group or maybe send the link to you. My number is 98300 29224. I repeat, 98300 29224, because we will have a separate link, ID, meeting ID, and the password for every meeting. May I now request Kavita ji to please introduce our guest of honor for today.
Yes. So good afternoon, everyone. As we know, our fast-paced lives cannot go on its own. We need to take care and be advised on the wear and tear of musculoskeletal system and ways and means of keeping our joints healthy, and for everything related to continuous moving lives. So it's a pleasure to introduce on board Dr. Abhrajit Ray, MD, Calcutta, MRCP UK, MRCP London. He's a renowned senior consultant, physician, and rheumatologist with over more than 20 years of experience in general medicine and rheumatology and vasculititis. He is attached to Radiant Medical Center, Fortis Hospital, Bellevue Clinic, and Woodlands Hospital. In 1985, he has also been awarded the Senior Fellowship, ICMR. He has a great working experience in UK for a period of 5 years, where he has been a registrar in rheumatology and neurology at London, along with a general medicine registrar also with the Department of Rheumatology, Professor David Blake's unit. In spite of this, he has also participated in many interdisciplinary meetings and has many publications. He has been accepted for poster presentations in Shanghai, APLAR 2016 and EULAR ULAR 2017 Madrid. Over to you, Papa JC.
Thank you, Kavita. Thank you so much. Dr. Saab, you are like too qualified. You won't believe, for normally I have to sit down with making some homework for every subject every day, because it's a new topic and I have to learn what to talk about to my to the guest that we have here. But for your topic, I literally had to sit on it for 2 hours.
No, I must thank you for your interest, your varied interest, and your real passion for going through so many streams, so many aspects of it. It really speaks volumes about your patience. You're really trying to help people out. I must appreciate it.
Yeah, that's our first objective.
Grace, God's blessing. Yeah.
Thank you so much, Dr. Saab. In fact, this is the only objective here. We want to reach out to more and more people to make them understand about these small things that we have otherwise missed out on. So, Dr. Saab, your subject is so difficult, and sometimes I feel that it is not really talked about much. Why is it so? That we have normally, most of these issues are normally being dealt by our orthopedic surgeons. Why is this subject not on the prime focus here?
When we were undergraduate students in the 80s and 90s, I hope you can hear me.
Yes, I can, sir.
The main two focus in the undergraduate study was rheumatic fever from sore throat, which affects the heart, rheumatic arthritis, and carditis together, which is young people's disease, and gout. The remaining aspects of the disease, which I came here, and to my surprise, I found that we have a similar amount of people suffering from rheumatoid arthritis. 1% of the Indian population means 1.37 crores, out of which 80% will be young ladies in the prime. And they do not know, and unfortunately in the undergraduate syllabus, our teachers did not teach that much. Maybe the maximum expansion of rheumatology, immunology has happened since the 1990 onwards. So the last 3 decades, we have had the maximum explosion in immunology and rheumatology, along with the advent of new drugs, medicines coming into the thing. You might have heard of biologics. You might have heard of some rare drugs called JAK2 inhibitors, which has come in rheumatoid. And they have actually revolutionized our treatment to a great extent. The reason is previously in the 60s and 70s, our teachers used to say, come on, nothing much, only exercise. Not much can be done about it. A sort of very negative attitude whenever somebody, a young or old, came up with something. And if you had our kind orthopedic colleagues who could do the replacements. But fortunately for them, their replacements, their arthroscopies, everything is advanced. At the same time, our medical aspect of treating and preventing progression of joint damage, muscle damage, bone damage, prevention, that's what I'm highlighting. You want to prevent that. That has then expanded tenfold. So that is the thing. And with the explosion, we are also getting something like in diabetes, you get what is called HbA1c or a control, which has become a sort of norm. If people tend to, diabetic, they tend to know that. Similarly, for our diseases, we have also got, especially for rheumatoid, Ankylosing gout, we have called what is called a treat to target. Whenever you are treating, you want your patient to go into the ideal state of health. We are not saying that we are curing the disease, but we can control it so well that you can lead a normal life, whether it's school, college, or subsequent. So, and the other thing is a window of opportunity. What is meant by the window of opportunity, if you keep on neglecting your ailment beyond years, then the joints and the bones and everything get damaged. So if you have developed a degenerative arthritis or a wear and tear of your joints, after 5 years of rheumatoid, a bad hip or a bad knee or bad finger can make a young person, even 30s, 40s, a cripple. So that is important.
Okay, Doctor, I'm sorry, I interrupted here, but how do we decide when to go where? I mean, suppose if I'm a patient and if I have a severe body pain, now I decide to go to a hospital or see other doctors there. So when I ask them, they normally recommend us to an orthopedic surgeon. So how do I decide that I need to go to you or go to consult with someone like you?
Let me tell you, because the awareness of rheumatology has spread, and explain the younger generation of orthopedic surgeons, they are perhaps referring us even more to do the orthopedic part of it, which is the surgical part of it should be there. But if you can prevent a surgery instead of an age of 70, 75, you don't want to do it at the age of 40 or 45.
Yes.
You go to Dr. XYZ, who is a rheumatologist, who treats you. At the end of it all, I would be, if we cannot prevent the progression after 10, 15 years, in some cases, they would be getting back their surgical skills on them. So basically, because the patient number is huge, and the much more interesting thing is the window of opportunity comes when you do not neglect the first few years when a young man, lady, or a child is complaining of joint pain.
Okay.
The thing you must realize, a lot of stress in work, sleeplessness, that by itself can cause a lot of muscle pain, the anxiety, stress in modern life. So that is very important to say, which is the functional part or the stress-induced part, that you have to separate from a guy who genuinely is suffering from something which can be prevented. We have fortunately a lot of blood tests which have come over the last 20 odd years. You must have heard rheumatoid factor, anti-CCP, ANA subgroups, ANCA, and so on and so forth. Other thing is, with the advent of CT and MRI, along with the digital X-rays, which is better than the conventional X-rays which we had 30 years ago, you're catching the disease much more early. For example, a young man with Ankylosing spondylitis who has been suffering, if at all, an MRI will show the disease in his sacroiliac joints in his spine. 8 years before it will be seen on an ordinary X-ray. So 8 years time you're getting in your hand to fix the problem before it becomes evident on X-ray. And if it's a young man within school, college, his job, you'd be saying, come on, please arrest the disease first so that he can have a normal life, professional life, family life, social life, whatever you call it.
Perfect. So that means we get your point. What you're trying to say is that you are the one who helps us prevent.
Exactly.
We believe in prevention is better than cure. So we would rather go to you then go for the major ones. So, Dr. Sir, we have a very interesting concept. What we do is we have a group of people in WhatsApp. We have made a separate WhatsApp group. So when I mentioned about your name and that you are coming, so they all started shooting their questions. So we made a lot of questions with us. They're ready. I have to ask you now. But before that, I would request you to make it short so that you can, if we make it long, then you'll have too many questions to answer. In the meantime, if anybody has specific questions, may write down in the chat. Kavita will help us in asking them. And otherwise, you can always raise your hand. And when we start asking questions, we will unmute you so that you can ask your question directly. So the first question that we have here in the list is, what is arthritis, its symptoms and remedy?
Arthritis is inflammation of the joints. Arthron means joint. Itis means inflammation. Just like appendicitis means appendicitis.
Okay.
Achha. How do you know it? Pain, swelling, late stage deformity, and early and loss of function. You are unable to move the joint. And how will you diagnose it? The history of the thing. It could be traumatic arthritis. We have had, while playing, you have injured an ankle. That is traumatic. And then you went on to degeneration. Even somebody as great sportsman like Kapil Dev Nikanj has had bilateral knee replacements because obviously he had overused his knees during spending his heart out bowling for India. Plus, he was a great bat, everybody knows Kapil Dev Nikanj. So, you have to know what is the cause of inflammation. Some of this arthritis will fortunately be short duration. Short duration means 6 weeks or less. 6 weeks or less can be you have a viral infection, a dengue, or something. Even COVID in 15% cases causes joint pain. So that is important. You can get in chickenpox, all viral diseases you get. In bacterial diseases also you get. As a part of the general high fever temperature, you can get a bit of joint pain. But they will go away within 6 weeks. If after 6 weeks, there is no history of trauma, there is no antecedent family history or anything, but the patient has a swelling of 1, 2 or more joints. If it's 1, we go for mono. Mono is 1. Then oligo between 2 to 4. And poly means more than 5. Each have their stereotypes. If it's a one joint involvement in India, you can think of gout, you can think of tuberculosis, which is common in the community and treatable, tuberculous arthritis. If it's between 2 to 4, you have something called spondyloarthritis or reactive arthritis. Somebody has a urinary tract infection, a diarrhea or dysentery, develops a pain in the ankle, knees, maybe a few other joints. That is between 2 to 4 joints. And we are seeing the pattern of involvement. Mainly, it usually affects the lower extremity, your legs, ankles, knees, etc. But if it's more, 5 or more, polyarticular, then that's much more important in a way. Polyarticular means multiple joint involvement. If it's symmetrical both sides, the commonest inflammatory disease is a disease of young ladies called rheumatoid arthritis. 1%, which is huge, I would say. And then you have other things like symptoms. You can have rheumatoid like psoriatic arthritis. Psoriasis is a disease of skin. Many of people do have, about 10% of the world population have it. Some of them will develop arthritis. Some of them can be symmetrical. Late stage of gout, polyarticular gout. So multiple joint. Also chikungunya, people who have suffered from chikungunya in the past. It was there in Bengal, it was there in Karnataka and a few states. Even after the disease went away, that fever went off, the skin rash went off, they are left with persistent joint pain for several months or even years. So polyarticular means 5 or more. This is the basic. And whether it's symmetrical or asymmetrical. Symmetrical is obviously both sides affected, or if it's asymmetrical means one side or some side. On top of that, you have the spine involvement. Spine is spondylon in Greece. So anything where there's a fire is itis. So when your spine is on fire, it's spondylitis. And it can be of two types commonly, broadly. Degenerative type, as we get old, it is running in a family. Osteoarthritis, spondylitis, that sort of thing. Cervical spondylitis, very common. Some people say my headache hota hai, bada chakkar deta hai, and you attribute everything to cervical spondylitis. May not be true, but some part is there. And the low back pain, very common, postural, IT professional sitting in the computer for 8-9 years, hours at a stretch, no exercise. So that is important. And you say, come on, you have to do your exercise in between, get out of your cold environment, do a bit of breaks, shakes, yoga, whatever, fine. But out of them, there will be a particular group who will say, Doc, I can't get up out of my bed in the morning. This early morning stiffness, that is very classical of any form of inflammation or inflammatory arthritis. Inflammatory arthritis means you are getting out of bed, you can't move your joints, you are feeling rotten for half an hour. And then gradually, as you move your joints, have a warm shower, a hot shower, or do some exercises, it gets better. That's a different thing, connotation, inflammatory, low backache. And that is usually worse at night, early morning. While degenerative thing, if it's wear and tear with age and everything, it tends to get worse as the day wears on. You know, you're doing your family chores, your office chores, you're feeling thakavat jo hota hai. That usually comes in the evening time. You're overusing your joints, you have done too much work today, your joints pain. Now with the COVID scenario, maid servants aren't appearing, lockdowns everywhere, so you're doing more work than normal. And also remember, and the last thing is the stress factor in modern life. You must remember, stress is very important. If you don't have a good sleep, you're very likely to have a bit of aches, pains in the body. You don't feel fresh, you feel something is missing. That sort of thing.
My goodness, you answered all the questions that are lined up already. So arthritis is such a huge topic. I mean, I did not know that arthritis is spread from head to toe. Can be anywhere.
Yeah.
So all this, even the back pain can be arthritis. I mean,
yeah.
Oh, okay.
We call it back pain means spondylitis.
Okay.
Spond means bone, that spinal bone that we have, the vertebral column is spondylon in Greece, and you have the itis, so you have a term for you, spondylitis, whatever. We call it spondylosis or spondylitis.
So we almost had a proper study on this subject today. One whole chapter was discussed. I think we can all answer questions here forward. And I did not know that because I was looking at myself with these small, kahin mere ko bhi arthritis hoga zarur, because I had this pain. I tried to cover with exercise. Now, what are the remedies? I mean, each has to be dealt separately then. You cannot have a standard remedy for each part. It's such a huge...
you have to think about it. We depend on the pattern, the evolution of arthritis. That is one part.
Yeah.
It's evolving. I told you, it's mono, oligo, or poly.
Yes.
The body is affected. What is your age, sex, lifestyle, you're a smoker, non-smoker, you drink or you don't drink, everything comes in. The other part of arthritis is whether it is coming with something besides joint problem, which we call extra articular features. Most important is fever. The fever is very important. You can have arthritis or this group presenting as unknown fever. You have thrown antibiotics. The doctor has given 3 weeks of antibiotics, A, B, C, D. It hasn't responded. It will not respond because there is inflammation, not infection. Infection. So that is skin rash. The skin rash is very important because in chikungunya, dengue, with COVID even, you might develop some skin rash. It is coming up. It is common in psoriasis. Psoriasis is a very common skin problem. You find it in the scalp, in the ears. You find it in the gluteal, intergluteal region, back sometimes. So skin, that is the other aspect. My friends dealing with lungs, because that's a rheumatoid or my diseases, the vasculitis, which is affecting the lungs. Interstitial lung disease is common with arthritis. Then you have things that which Nandini must have spoken to you, dry eyes. A lot of dry eyes come from autoimmune disease, and you've gone to the ophthalmologist and they have said, come on, this is because your arthritis is affecting your eye. Like ankylosing spondylitis, you have iritis affecting your eye, or Behçet's disease, mouth ulcers with iritis, uveitis affecting your eye. So it can be multidisciplinary, and it doesn't have to come to me straight away. It will be referred, say a dermatologist referring a psoriasis with psoriatic arthritis to me, or an ophthalmologist who says, mind you, in angspon, 85% come with joint pains, whether it's a spine, whether it's a knee, ankle. 15%, they present with the eye problem first, red eyes, blurry eyes, painful eyes. And these guys, once they look, they say, come on, it is your arthritis which is affecting your eye, go to a rheumatologist. That 15% we also have to handle. So it is a multidisciplinary, and let's put it this way. Subject is expanding too fast. It is multidisciplinary. We have to work as a team and be careful. What I always tell my patients, if you have seen any other specialist, even an alternative therapy, I'm not against that. If you have seen a Ayurveda or an homeopath, please bring the prescriptions, because we want to see the findings as and when they have seen you, because that can change over a period of time, both because disease itself or because of the medication given. And we have to sum it up, a human being as a whole. And as I said, mind is also very important. If you see, as you said, stress brings it on. Lifestyle is important. Nicotine was smoking, let me tell you. Smoking is one of the biggest no-nos for ankylosing spondylitis, rheumatoid, inflammatory arthritis. It's not just coronary artery people are getting, or COPD with the lungs people are getting against tobacco. No. You also here, they have a very positively damaging effect on the body's system. Plus the immune system. You must remember, we are sitting on immune system. That is very important to, you have to keep your immune system under control. Whether you tackle a virus like COVID, common flu, bacterial infection, pneumonia, anything. Your immune system is what sees you through, and which you protects against, and most important, cancer. Today in Woodlands, I had the thing referred from Tata Medical Center, Calcutta. Patient had been treated. He was a 65-year guy who has been treated for acute leukemia. That is under control. Maman Chandi has done it. It's under control. But his now problem is left knee pain with swelling. So that has to be handled because he's complaining of pain in that area. So you understand, it's all interlinked. I always say, I always request my patients, if you please come, and if you have old reports, please keep them in a file so that it's not possible everybody to remember all the details. At least we can browse through them very quickly and get to see if there's something evolving out of it.
Okay, interesting. Now, which means that we understand that arthritis being such a huge subject, there can be no single remedy for each in different types of arthritis that we suffer. So depending upon case to case, we need to address them. So such general questions cannot be answered at this forum in such a short time. So we move on to the next question that we have. My son is 22 years old, absolutely healthy, but his hands shake when he is holding a glass or plate. What does it indicate? Does it indicate anything that he requires any test to do now?
I think they're important. Does it shake? If a hand shakes, the common thing I'm looking into is thyroid. Because hypothyroidism, you have to go to an endocrinologist or a very good GP. He would detect it, that this is coming out of thyroid, and he can at least control the hypothyroidism through their means. I'm not going into details of it. The drugs,
yes.
or surgery, whatever the thing, the goiter, that sort of thing. And that is the commonest cause. The other thing is anxiety by itself. And anxiety before a stress, before an examination, before other things is fine. It will go away once your critical position where you're placed yourself, that goes. That stress factor goes, you come back to your normal self. Then there come those shakes is because Is there anything in the family? Does the grandfather have what is called a senile tremor, when the head shakes or the neck shakes? Or they have some Parkinsonism or some other neurology problem which can cause shakes. And sometimes some of them are inherited. So then comes the neurologist part. You understand that? So not only we will see these patients, we will perhaps channel them to the right field, so that if it's a thyroid, perhaps I'd be sending to my endocrine colleagues, or if it's a neuro, I would perhaps give. And nothing at all. Everything is fine. His muddy muscle body, everything is built up, but his hand is still shaking. If it's a senile tremor, how do you know? Indral is one thing, but he'll be happy if he has, I'm not advocating it, if he has a glass of wine, the shake comes down.
Okay.
Not always medicine.
It's all up here.
At least, yeah, alcohol relieves tremor to some extent.
Okay.
It has to be found out what exactly is his problem. So you have to be looking at the whole aspect of it and get the history out of this young gentleman. Then we'll take it from there.
Okay.
Yeah, the later trait with age, the neuro, uremic tremor, kidney, liver, everything can cause shakes. So that's not it, but that is at a senior age, usually 45, 50 onwards, that we start developing those shakes from that reason.
Okay, we move to the next question here. The question is, during the lockdown, when my cook could not come, I had to knead atta with botha. Atta dough for rotis. I realized that I had pain and slight swelling in all the small joints of my fingers. The pain was bad. What do you indicate? What does it indicate?
What I would do first, it is an unusual exertion because the maidservant hasn't come. That's the underlying theme.
Yes.
But kind of family history of arthritis like rheumatoid? That is a very important question. Number two is whether we should, if it's persisting for beyond 4 to 6 weeks, first you give something simple like Calpol, Crocin. If it goes away, fine. If it doesn't, you give some low-dose anti-inflammatory. Low-dose anti-inflammatory like naproxen, say 250 milligram twice a day, with some antacid, and observe the person for 4 to 6 weeks. It has gone away completely. You are happy. It's not coming back. But if it's still persisting after 4 to 6 weeks, I will do, which is good because this has come over the last few years, ultrasound powered Doppler of the relevant joints. This will show if there's fire in the joints. If there's fire in the joints, it means, which we call synovitis in our so-called technical term, that this indicates you're having early inflammatory arthritis. And that is the time when you want to strike the iron when it's hot, not 2 years down the line, when some of your joints have started showing erosions, you have already developed some damages secondary to 2 years of arthritis and gnawing into your joints and perhaps damaging the muscles as well. You must have noticed, if you keep a joint not moved, say a hand in a plaster or something, the muscles tend to shrivel up. The muscles don't work, therefore they shrivel up. So whenever you have an arthritis, you would invariably, or chronic arthritis, you will see the joints are getting swollen, but the muscles are getting withered. So you're wasting away your muscles. So it is much more difficult to put them back on the track as the muscles go withering. Plus, in inflammatory arthritis, you invariably get osteoporosis, the weakening of the architecture of the bone. Osteoporosis is painless, but a fracture is painful. So we would want you not to have any damage. Cosmetically, obviously, your hands are very important. You have to knead the dough, because how do you see yourself in society, sitting with your friends, having a chat, or cocktail, or anything, or party? So that sort of thing. So your cosmetic reason as well as the functional reason, you would like to treat it early. If after 6 weeks it is still not going, you better show a rheumatologist nearby.
Great. Thank you, sir. Thank you. In fact, now what we are getting into now is another topic: the backache, the low backache. Now, I'm reading out two questions. They are both, I think, the same answer you will give, but I would like them to know that I read out their questions. My work involves sitting in front of computer 8 to 10 hours daily. Lately, I have been noticing severe low back pain. When I get up in the morning, what does it indicate? It has been there for almost a while now. Next, I am 26-year-old woman. I work full-time sitting in front of the laptop. I try doing planks daily to be fit, but my lower back pain has not decreased at all. It keeps on hitting me all day. They're both similar question, so you can suggest what to do now.
One is the young lady, 26 years, who is getting backaches throughout the day. That could be a disc problem or a digit problem, because sometimes over-exercise can also cause it, by the way. It's not just lack of exercise, over-exercising, damaging. So a disc problem, commonly you would do a digital x-ray of the DL spine in standing position and also in the lateral position. So see what is the condition of the disc spaces roughly, the bones, everything, and you would treat the patient conservatively. If it doesn't resolve within, say, 4 to 6 weeks, you might go for an MRI to see whether, because that will show the inner disc prolapse or something which has happened. But the first one is different. Yes, the young guy sitting on the computer, fine, but his trouble is in the early hours of the morning, when he's still fresh, or at least he is got out from sleep in a better position. That speaks more about inflammatory arthritis. We would like to know whether he has this sort of buttocks pain at night, difficulty in turning in bed at night, रात में कलवट लेने में दिक्कत होता है या नहीं.
Okay.
That sort of thing. Early morning, you are feeling stiff. How long does it take for you to become normal? Is it more than half an hour? Then it's significant, not 1 or 2 minutes. If it's more than half an hour, and then gradually it eases off as you exercise, do yoga, do a hot shower, that sort of thing. The first guy is likely to have what is called Ankylosing Spondylitis group. We have to rule that out, I'm saying. And that can, as I said, all our diseases are multifaceted. So because it's the young people, we have to keep about the joints. We have to keep about their eyes, which is the red eyes, blurry eyes, and history of that. We have got to doctor. Other thing is bowels. This is called the inflammatory bowel disease. It's a severe bleeding and while passing motions, multiple bleeding, abdominal cramps. You must have heard of ulcerative colitis, Crohn's. They can be associated. That's a third thing. And the fourth thing is psoriasis of skin. Normally, you may not find it if you don't look at it carefully. Somebody with a florid skin rash will go to a dermatologist, no problem, or at least to a GP. But sometimes you find psoriasis there in your scalp, behind the ears. You understand? Intergluteal fold, between your buttocks. Those areas are hidden areas, or umbilicus. That you normally should be, if you think about it, then you'll be looking in those hidden areas with the kind permission of the patient. Otherwise, you miss the diagnosis. You understand? I had a good businessman who he was thought about spondyl, low back pain, something. But I found, come on, his nails had a bit of pitting. They have some changes in the nails. And when I asked him, he said, yes, I do have a few of the skin problems in my odd areas. Not only that, my mother had psoriasis. Big. Mr. Dalmia, he had major skin, his mother had major skin psoriasis. I said, come on, you've been suffering from psoriatic arthritis. That's why, and he told me one of my drugs, he felt that, come on, he was dieting to the point that his arthritis was going away. I said, no, you have been taking a drug called sulfasalazine Sazvo, which was given for a different reason. That was helping your arthritis. It also helps psoriasis to some extent, psoriatic arthritis. It's not that sheer dieting and you have crashed yourself completely, that is contributing to your improvement. No. So you have to see a person as a whole. What I'm saying is, we're all human beings, so it should be wholesome. That sort of thing.
Great. So that means the patient has to, if you have a back pain, be careful. It's a wake-up call. It could be something which we are ignoring. Rather get to the doctor and try to get yourself tested. Okay, we have Reena Sharma ji who wants to ask a question. Can we unmute her? I have unmuted you. Please ask your question, Reena Sharma ji.
Hello.
Hello.
Good afternoon, sir. Sir,
afternoon.
I wanted to ask, my sister-in-law is of 50 years of age. She has arthritis. I think I'm sure. I'm not sure about the particular name of it. It's the initial stage of arthritis. She's 90 kgs in weight. From 5 to 6 years, she's having severe pain in all the joints, and we have consulted a number of doctors. But everyone suggests do this, do that. I can understand they will just suggest, and it is in her hands to do it. But she started taking a lot of painkillers like Pyrogesic and Etoshine, Izac. अब ये हालत है कि अब उनके कोई दवाई असर करना बंद कर गई एंड सेकेंडली अब उनका वजन कम करने का सोचते हैं, जैसे डॉक्टर्स उनको बोलते हैं कि वॉक करो, ये करो, बट उनके पेन इतना रहता है, शी इज नॉट एबल, मतलब एडी से लेके घुटना, बैक, द एल्बो, द एंकल, दिस हाथ, एंकल का एवरीथिंग, मतलब वो जहां हाथ लगा तो उनको लगता है कि मेरे दर्द है. नाउ व्हाट वुड यू सजेस्ट कि अब फर्दर व्हाट शुड आई लाइक ना, दवाइयां लाइक शी टेक्स ऑल दोस D3 मेडिसिन्स आल्सो, Evion आल्सो, लेकिन कहीं मेरे को कहीं भी समझ में नहीं आ रहा है कि उनको कोई फर्क पड़ रहा है दर्द में, स्पेशली, एंड एक्सरसाइज पार्ट शी इज नॉट एबल टू डू बिकॉज ऑफ द पेन. So what would you suggest, sir? Thank you.
From the history, it would have been nice if we gave at least a picture of her joints, the pattern of involvement, etc. We know that in our vegetarian friends, B12 deficiency and vitamin D is quite rampant. Though we are also getting overcorrection of them because of over-enthusiasm on our part. Let me tell you. The first thing is B12 and vitamin D taken care of. Then I would like to look at the aspect of the joints part. Secondly, if it's whenever you touch any part of the body, it's painful, I would be looking into a particular aspect of the disease called fibromyalgia. Fibromyalgia is pretty common. These people, not only sometimes they have lack of sleep or poor sleep, they do not feel refreshed at the end of waking up. They also have what I call exquisite tenderness of the muscles and tissues. Whenever you have a little bit of pressure, they'll start complaining, bahut lag gaya, bahut lag gaya. The other thing, you have to find out, at least some rheumatologist has to see her. I would be, if whichever city, I'm sure all the Indian major metros are now.
I'm in Kolkata only, so
Kolkata, fine.
Your chambers details, so I could just consult you only, then it will be better, because I've consulted so many that now I'm tired to whom to go.
No, but that's it. I believe there is two aspects of it. How much is the disease itself, the joint muscle problem, nutritional deficiency itself, and the other aspect is how much is the stress secondary to the depression, seeing recurrent, repeated doctors and not getting results. That by itself is frustrating, it's depressing. That will also have a secondary effect. And by fibromyalgia is something which is common in ladies between 30 to 60, more in postmenopausal. And they actually require a very careful history taking just to exclude the treatable causes. And also they should be able to understand what is causing. They have a low pain threshold. In other words, if you give them a little bit of pain or a tinge, they can, the body actually feels much more. You're hyper-excitable. That pain receptors are a sort of hyper-excitable. They are overreacting to a little bit of stimulus. In fact, since we are not going to there are drugs which gradually calms them down, helps them, but we have to see her as a whole. You understand?
One more
can you give your, excuse me, ma'am. Excuse me, madam. Madam, there are two of questioners asking, so can we
okay. Thank you so much.
Can you share your number, phone number, so that she can connect?
It's kind of you. I will be perfectly happy to see her.
What's the number that you would like to flash here, sir? Any number you want to give? I'll just write down.
You can give my number.
Yeah.
9830042828. But please do remember, I'm also in Bellevue on Thursday and Woodlands on Tuesday mornings. I've just completed my Woodlands chamber after the lockdown. Bellevue will be any Thursday. Normally it's 10 to 2, but because of the lockdown temporarily, I'll be keeping between 10 to 12.
So
Most welcome.
I repeat the number 98300422828. You can message to our doctor with a reference of Papa JC Talk Show. He will
Absolutely. It's everything is Papa JC. You
Thank you.
mentioned that. That obviously carries a lot of weight, and we'll definitely see.
Thank you. Okay, Kavita ji, you have some questions lined up. Would you like to share them out?
Yeah, I have few questions.
Yeah.
So, I have lower back ache and pain in lower leg, especially the calf area. I am relieved on rest, but it happens more during the afternoon and evening. Also developed severe milk allergy in the last 2-3 years. So what should I do?
Assuming that your calcium vitamin D levels are normal, then I'd be the age of the patient, please.
Age is not mentioned. Age is not mentioned.
Then it's a huge level of.
Is that question from Neeraj ji? Is that question?
Okay, it's the he's written now. 48 years.
Okay.
48 years.
48 years. I'll be inquiring about, if it's the lady, I will be inquiring about her periods, whether she has had a menopause or irregular periods. About
Kavita, let's make it short. Neeraj, could you ask the question directly, please? Neeraj, could you ask the question directly? I'll just unmute you. Ravi, can you please help me unmute Neeraj Gupta? Okay, we'll give you. You just raise your hand. Neeraj Gupta, raise your hand. I'll get you there. We have Mr. Neeraj Kumar waiting in the queue. Can you ask, please? I'm unmuting you. Mr. Neeraj Kumar, you are unmute.
I am 47 years old. I am suffering from psoriatic arthritis. My B12 and D3 levels are normal, and the pain is quite acute. I am being treated with methotrexate for the last 1.5 years. My question was, we have recently heard about a medicine called Abhrajit, and another new thing which we've heard was biologics. So
Yes.
I just wanted to evaluate on terms like Abhrajit, methotrexate, and biologics. So comparing these three.
Number one, for skin reasons and arthritis, methotrexate does work, at least partially. The other two, sometimes leftonomide also works. Abhrajit is a new medicine which works partially in the joints as well as in the skin. So that will be my second choice. Third choice is, if there's no option, because biologics are most expensive, but they also work very fast. We have what is called SCAFU, secukinumab, which is anti-IL-17. These work very fast. They can cause a disappearance of your skin lesions like magic, 95 to 100%. The arthritis joint pain reduction is roughly 50%. And the other group of drugs which work in psoriatic arthritis, anti-tumor necrosis factor. Now, these are biologics, high protein molecules, each with their own specificity and way of using it. Some of them are intravenous, like infliximab, secukinumab, all these sort of things, and most of them are nowadays available in a subcutaneous form which you give under the skin. And you must have heard of adalimumab biosimilars.
Yes, yes.
Yes, you must have had of other drugs. So all of them would be known to you, but it depends on what is your scenario. Say, if somebody has a past history of TB or he has a family history of tuberculosis, which can happen, then I'll be more likely to, and the skin lesions are more predominant. Skin is the major factor. As a biologic, I will put SCAFO or anti-IL-17 over it. But if the arthritis is the main factor, you don't have a past history of TB, your family members have TB, then from previous experience over 20 years, we are going to use what is called tumor necrosis factor inhibitor. If somebody wants a very quick response, you go for intravenous infliximab. If you want a slower response, you want to attend your office, do your chores, family, everything, you can go for subcut adalimumab biosimilar.
Yeah.
You understand? So the options are many. We can tailor it according to the patient's profile, their family history, their organ involvement, if it's skin, joints, nails, what sort of problems you're having. All of them, that sort of thing. Okay.
And so, what is the time span where we take biologics? Suppose we start. So, how long will we have to continue this? Like a minimum side.
What we do normally is try to bring your disease to a reasonable level of control, and then we start to delay or space out the injections. You understand?
Okay.
For example, adalimumab biosimilar, we normally give it every 15 days. Once we know your parameters are fine, your quality of life is fine, we might give you 21 days. You're feeling better, monthly. Even better, 2 months, even better, quarterly, like that. So we can space it out. But the first thing we withdraw because of the cost factor is the biology. And we tend to keep the methotrexate in because that is the cheapest weekly dose available, and it suits whole of Bharat. It doesn't really, because that's not a costly proposition at all. And Aplavia is somewhere in between, not very expensive. It has some benefits, both in the skin and in the joints, but it varies from person to person. Your
Okay.
treatment has to be individualized. Do you know that? That's,
Okay.
and no smoking, sir. That is one thing which makes me mad. Smoking. I'm not against drinks, but tobacco will unfortunately increase your problem.
Would you like to go and record? Would you like to go and record prescribing drinks? Okay.
This
Friends,
is a rather antisocial time. One thing is 2 glasses of wine or 2 pegs of whiskey isn't too bad at all. It's good for the heart. It's good for many reasons. But yes, all of us know in excess is a poison for the heart, is a poison for the liver. And most of all, family life, the better ones, better halves tend to get extremely rough. And I will lose my practice if I definitely.
You won't believe you had doctors down the line, and one question comes back invariably: prescribe for today. Okay, friends, we have to understand. Sir, why don't you have some water? Because I feel that you need 1 minute's break because you are actually going on, and the question is not ending so easily for you.
Oh, you're fine.
Okay, friends, can we request for a short question because we are going very lengthy on questionings? Then it will only become too personal.
No, you can go ahead. No problem.
Okay, I'm putting on Chetu Singh ji. Chetu Singh ji, are you there? I'm unmuting you. Please start your question.
Good afternoon, doctor.
Good afternoon.
Doctor, I am 37-year-old. I have lost my weight also, but the problem I am facing is I am getting positional vertigos, and on one point I am getting my knee pain. But I really don't know. Is it a matter of like I'm heading towards something because I'm getting to the strength training and weight training? Does it leading to that problem of arthritis? And sometimes heel pain is also there. But I never take a medicine for the heel pain. But this vertigo problem, it frequently comes. I am very much like conscious about this thing. Whenever I try to lift the weight, suddenly it comes up and suddenly it goes off. And it stays for 15 days or 20 days. So just it's kind of a second it comes. Like on the right side, it is coming, the vertigos. Suddenly I fit on the center, the vertigos go. And suddenly if I go on the left side, vertigos comes. So is it something related to rheumatitis or something?
No, I could suggest you go and see a ENT doctor because in the balance organ in the inner ear, the vestibular thing, they can cause the change. The other thing is the vertigo lasting a few seconds only when you are changing your posture, like getting out of bed or changing your position of your head for a few seconds only? Or
Yeah, it's
more than
sometimes it is for few seconds, sometimes it is very long.
Sometimes it is with vomiting, sometimes it is not with vomiting. So,
My first aspect would be ENT checkup.
okay.
I'm sure you have had your dose of Vertine, or Histine,
Yeah,
your
yeah.
Vertigon, and every Stemetil MD, all has been
Yes.
checked by the local GP.
Yeah.
Once that goes, we will look at a few aspects. Number one is the ENT aspect. One is the cervical spine causing a problem, like cervical spondylosis. And other thing is do a thorough neurology examination just to find out what is happening. Okay, these three aspects I will focusing on.
Jeetu Singhji, for the first aspect, we are just sharing that tomorrow we have invited Dr. Ajay.
Yeah, JC Papa, I heard that. Now I think I have to attend that also.
He's coming at 6 p.m. tomorrow. Come in again.
Okay, sure, sir. Thank you, sir.
Gupta ji, can we? I'm lowering. I'm unmuting you. Please make it short. Savi Gupta ji, you are mute, out of mute.
Thank you. Good afternoon, doctor. Thank you for your. I had a MRI done last year in the month of February, and I had a disc bulge of C3-4 to C5-6. And after that, I just followed the set of exercises and kept my vitamin D and B12 all in control. But from the last 1 month, I'm having acute dry eyes, itching of skin, which you just mentioned, and little fingers, my stiffness, and my left knee is giving me a little problem. So I don't want to visit any doctor at the moment till say maybe mid-June. So till then, what should I do so that this doesn't get aggravated?
Is there a family history of arthritis? Your parents, brothers, sisters, anybody?
Yes, my mother. Yes.
Mother. Does she have anything called HLA-B27, psoriasis?
No.
Reactive, any of that sort? Because sometimes it can run in a family. The next thing, along with a bit of the ankle involvement or other joint involvement, maybe a bit of skin rash, that is usually might be coming towards me. I don't know, but that sort of. But basically, it could be a rheumatological disorder manifesting at different sites over a different time frame. And have you tried your NSAIDs, the painkillers like whatever, Etoshine or something?
I just rub a Vovron or something and I get better with it for my pains. But I'm just wondering what should be my future set? I mean, I do need to see a rheumatic arthritic doctor, right? But till I cannot reach to one, if I have developed some pain and all, so what should I do?
I would rather suggest initially you take Calpol 650 twice a day. The safest thing. If you don't have allergies to NSAID, take naproxen. If it's below 50 kg body weight, I'll go for 250 twice a day. If it's above 50 kg, I will go for 500 milligram twice a day after food with some antacid, say a Rantac or Pan40 or something.
I take Spondin. I don't know if you're aware of this medicine called Spondin. With that, I'm okay. But then at times I do feel there's a little, my head is getting a little swirl. Chakkar jisko kehte hain.
Now, we have to, as I said, the other thing which we normally do very quickly is just to see how significant it is. One of the biggest guidance, besides your history, there's a parental side, on your mother's side, a history. ESR-CRP. If ESR-CRP, the routine blood tests, they're not great. If they're above normal, they would tell that this is not a red herring, this is perhaps something we should be looked into.
Okay. ESR, right?
That's
Thank you.
Yeah, ESR, high ESR, high CRP.
Okay, thank you.
Thank you, Simiji. But can we request not to be very personal with your questions on medicines because we are on air and a lot of people are watching? Let's keep it more generic. Let's keep it more generic.
Okay.
Mr. Neeraj Gupta, you are on mute, off mute now. You can say. Mr. Neeraj Gupta, just a minute. Unmuted you. Yeah. I don't know. Dharmen, you can say.
Hello.
Yeah.
Yeah, this is Darshita Trivedi here, Dharmen's wife.
Yes, please.
I wanted to ask a question.
Yes, please.
Yeah, good afternoon, sir.
Good afternoon.
I'm 47 years old and I have severe pain in the joints below the big toes in the feet. So my doctor suggested to get the uric acid test done, which was normal. So what can be the other reason for it? Can you please suggest? It's so bad, the pain is so bad that whenever I wear closed shoes, it hurts.
The first thing is whether you have flat feet or not.
No, I'm not
If you have
flat-footed.
no flat feet, good.
No.
Other thing is if there's any family history of arthritis, like osteoarthritis. The common
Not
which affect in the toes, especially the big toe area, that area, is gout, which he has done the uric acid for. The other thing is osteoarthritis in the family. It runs in the family. Dadi, nani, others have some of it. So sometimes it can come to our generation, that sort of thing. And is there any deformity that you can see or swelling at the end of the day or early part of the day?
Not exactly. It is, I think, a beginning of a deformity, like not very prominent, but a little bit. So, like it's protruding from the side, you know, if you can understand.
It's in the anterior part of the foot, not the heel.
Not the heel, just below the big toe.
Below the big toe. Sometimes we have something called hallux valgus, with the great toe is moving sideways. It's not straight. It is bent at an angle, and sometimes it can be familiar. Again, the part of osteoarthritis can happen. Has any X-ray been done of that part? Any X-ray of your affected feet, of what you are complaining of?
Yeah, I had got an X-ray done.
Did it show anything?
Not really. So it should be arthritis. So in that case, what precautions can we take? Like, can you please suggest something which can make it better?
I would perhaps, first of all, do a routine blood test, which just not uric acid alone, a ESR CRP. If they're not high, I would perhaps, you have tried the common things like warm saline, foot bath, that sort of thing. Soft shoes, soft soles, or some hush puppies like thing, or sneakers, that sort of thing.
Okay.
That is the first thing you do. Warm saline foot bath, followed by a very simple sporty sports shoes. If you can wear in your home, that's fine. Or even hush puppies available. And they are fairly fashionable nowadays, so that should be okay. Except for special occasions, I believe you stick to that for about 4 to 6 weeks and see how it helps you. If the pain is more, you can have NSAIDs like naproxen, 250 twice a day with some antacid or PPI, and then you take it from there.
Okay. Thank you so much.
Kavita ji, you have a lot of questions. You just
Yes.
make it short. Dr. Saab, please make these answers little more objective, because it's like list is too huge. And if you feel that it's personal, tell them it's personal.
Questions are actually too long. Yeah. So my mom, she's 80 plus. She has stiffness in her finger joints. It started from the left hand fingers and gradually through the right also. Sometimes her fingers get stuck and she has to straighten with her other hand. So what medication can be suggested for it?
First of all, you find out whether it's inflammatory arthritis, like late onset rheumatoid or not, which can happen at any age, 60, 70, 80. At her age, if you have to give her, the simplest painkiller would be paracetamol, whatever name you can have. The other drug, if it's inflammatory, will be sulfasalazine. And in her age, I would perhaps say sulfasalazine, some proprietary brand, if you find that is inflammatory rheumatoid affecting the hands. And if it's pure osteo, then that perhaps occasional painkiller and paracetamol would be just enough.
Perfect. Next question, Kavita ji.
Okay. I'm an Ankylosing spondylitis patient. I went for a HLA-B27 test for my 21-year-old son, who also started having pain in his limbs. It came positive. He still keeps getting cycle of pain on and off. So we visited and consulted a rheumatologist. He gave us some few painkillers. So what should I do as he's suffering a lot?
Number one, healthy lifestyle. No fags in college, no smoking. Exercise as much as you can. Swimming is the best. provide the water is on the warm side. And obviously you cut your weight down to a normal level as much as possible if you're overweight. The first drug they has given is painkillers, but the drug of choice, if it's side joints, initially will be methotrexate, sulfasalazine for a young person. If it fails, then we go on to the biologics. And we have heard about anti-tumor necrosis factor, anti-TNF. We have about 4 available in India. Plus we have anti-secukinumab scafo, which also works in ankylosing spondylitis. We have a lot of choices. So it depends. We have to look at what he wants, his career, college conditions, and use it judiciously. That will be my suggestion. But first, I would give him methotrexate, sulfasalazine, and give a trial first. The cheap alternatives first. Okay.
What precautions should be taken for high uric acid for a person with family history of arthritis?
I assume by arthritis, you mean gouty arthritis. The first thing the 3 things of the list. Number 1 is, if he is a non-veg person, seafood. Number 2 is alcohol. Number 3 will be red meat. These are the 3 main troublemongers. Amongst vegetarian protein, little bit of dal, rajma, palak, but at the end of it all, with a diet control, you can go down by 1. So suppose the uric acid is 11, it will go down to 10, but we want it below 6. So you would require a long-term management with urate lowering drugs. We have 2. One is allopurinol, we have fluxostat. So both are easily available, and we can use intermittently painkillers for a short time till we have adequately covered him with the urate lowering drugs. He should be fine, but his attempt should be to keep his urate below 6 and avoid aggravating factors as much as possible.
What
feasible.
You mentioned 2 medicines. What was that, doctor?
Urate lowering agents. One is allopurinol.
Allopurinol.
It's the name of Xyloric available here.
Okay, Xyloric. Okay.
Xyloric acid. Other one is febusostat, which is available as Feburic, Febutaz.
Or Fabutaz.
These 2, they lower the uric acid, and our aim is to bring your uric acid below 6 permanently. Mind you, it's not just the blood uric acid below 6. Gradually it takes for your joint uric acid, which is a separate compartment within a joint, to gradually come through your bloodstream and come out through your urine. So just a reduction in blood may not be enough reason to be happy. You have to make sure that your joint stays quiet.
Excellent. You've actually answered a very, very important question just now. Uric acid is a very, very big issue for a lot of people for their food habits. And I think this will help them. So next, Kavita ji, next question.
Yes. What causes costochondritis? What are its symptoms and what is the remedy for it?
Costochondritis is pain in the rib cage, and it is commonly viral. Whenever you're having dengue or other reasons, you can get viral costochondritis. The other common cause is, as you said, ankylosing spondylitis or others. They can cause very severe rib cage pain. And the third is traumatic. You have had rugby, you have played sort of contact sports, and you got a lot of injury there, and it just flares up. So each will have their own treatment. You understand that? If it's viral, most likely it will go away completely. If it's angst-spawn, then you treat the angst-spawn so that the overall disease can be controlled with the NSAIDs, which are important, along with the biologics or other drugs. And if it's traumatic, you have to take care till the bone heals.
Okay, in between, Kaptaji, there's one question coming from Abhrajit Agarwal. He wants to know treatment for bunions and hallux vagus. I don't know what it means. Hallux available as options to avoid surgery.
It is your great toe is getting deformed and getting outwards like this. You understand that?
Okay.
Outwards. Sometimes it's familial, then it's difficult. You understand? हम लोग सिर्फ पैसा नहीं पाते from the ancestors, we also get the diseases from them. So genes have to be kept in mind, like diabetes, pressure, they also can. If it's not that, if it's not injury, then yes, it depends on the degree. If you can do, there are nowadays foot specialists to deal with the architecture of the foot, keeping you there. That's all. Physiotherapy departments, a few of them might help you with the feet exercises. Try to see if it's a rigid one. If it's rigid, then it's difficult. Then the surgery comes more often. But if it's more flexible, then perhaps they can do it, set it about without trying to get into surgery. It depends on the degree and the rigidity, both of them.
Perfect. So you see, we have people listening from different avenues. This question has come in directly on a message. Maybe he's following on the Facebook. Okay, next question, Kavita ji.
Yes. My son is 22 years old, mostly healthy, apart from being a bit overweight. He has been having involuntary thick movements in his neck and shoulder for a long time now. There is no pattern for these movements and they happen at any random time. He had shown it to a diagnostician who suggested a nerve conduction test, which came back with no issues. It doesn't hamper his daily life, but it worries me since my family health isn't very good. Please advise if possible.
The best thing is we to assure him first that he doesn't have a problem. If you say the tics are because of internal stress, somebody might have been teasing him, his college mates or somebody from school onwards might have teased him because he is just the lalu boy, the typical pizza eating, lovely, happy, jovial fellow, and suddenly he's been teased to the point that he becomes over-conscious about his physique and he wants to lose weight and all the compartment. And tics usually come whenever you are stressed out within. So if reassurance, all sorts of things doesn't help, perhaps a gentle chat with a psychologist. I am not wanting psychiatrists. Psychiatry is full of medicines. They won't have the time. Any good adolescent or slightly young psychologist, so that he can unload himself, go through the history. So normally they give a history of teasing in school or some college, somebody making, and he is perhaps an introvert chap who doesn't want to share his inner frustration. They are very closed up people. So that manifests more as tics. That is sort of thing. Tip is a functional thing, nothing to worry about, except that it is a bit of an embarrassment for the one he is having it, and that can even bring it on more. That is unfortunate. When you're anxious, you tend to make mistakes. So that comes out all the more during stressful scenarios.
Perfect. Okay, I have a question coming in from G3. I am a patient of Ankylosing Spondylitis. Difficult key code simple. I had a biological injection, Remicade or Remicade in 2014-15, and then Symphony till April 2017. Not in much pain, but have bent from neck. How can I get my posture back? What could help me?
First of all, you must go to your rheumatologist and you will see your x-rays, both in a flexed posture and erect posture, just to see in Angspon. Some of the joints are fixed. You can't change them once they have become fixed. But the drugs used have been correct, but we don't know how much they have been used and over what period of time. The other thing is simple things at the beginning is to lie prone on your tummy, Pet ke upar so jao, so that if you have a curve, a hump, that secondly is to do good physiotherapy. And best part is swimming. If you can do proper swimming, especially during summertime, at least half an hour to 1 hour daily, irrespective of what your job is or your study is, that will go a long way in collecting your curvature. But then you have to see a rheumatologist because we want to know how much is correctable, because you have had Remicade and Symphony, which should have helped quite a lot. Otherwise, do you require other things to get it out? How much is permanent and how much is there? Even a digital X-ray of the neck dorsal spine will help us assessing how much is a permanent damage and how much is not.
Okay, but the swimming is shut now in this current scenario. Any other
scenario? Other thing is to go for yoga, number one, cycling, and cross trainers. You can do that. Cross trainers is good because you just stand and do it on the spot.
Jeetu, you got your answer you want to ask directly, please? Okay, we will move on to the next question I have received on my email actually. I am a 60 plus female. There's a stiffness in my right knee, joint and right hip joint. As a result, I find it difficult to sit cross-legged for long periods doing yoga, where there is no problem in the left side. Why is it so? And what can be the possible remedy? Is a knee replacement worth it? What percentage of knee replacement are successful? So there are two parts. I'll read it out again.
Mm-hmm. I've got your point. First of all, is happy with her left side, not so with her right side. The important thing is to get some x-rays and see the degree of damage. Then has she got through all the usual things like losing weight, physiotherapy, glucosamine chondroitin, and something which I tried first before embarking on major surgery? Because what she's asking is replacement. The age is fine. Does she require an immediate replacement now? That only we can assess from seeing the patient, see the degree of joint space narrowing, and also see how much she can do with her leg. It is better to avoid sitting cross-legged or doing too much yoga. Now, yoga postures at the age of 20 has to differ from somebody who is doing it at the age of 60. You must realize that is the basic fundamental. Not every yoga can be done with the same intensity over our whole lifespan. So we have to adjust it, but try to prevent bending or putting too much pressure on the affected knee as much as possible. And that should be there. That should be there.
Okay. The next question is again on email I received just now. Sir, I am having pain in my both hand, fingers, wrist last 6 years. But last 1 year, the pain increased and was shifting upwards in right hand, and then 5 months back shifted to right elbow. And 2 months before it shifted to both upper limbs, and thereafter in both shoulders, upper limbs, left neck, and right now. Right now, when I take my hands backwards and straight, I have bad pain and giving me a lot of pain while going to sleep, and have to take painkiller and sleep every day. Please advise. Now, there is no full stop paragraph. I don't know if it made sense to you.
It looks from a history. That's most likely a case of rheumatoid arthritis, which has not been tackled early enough.
Okay.
It's spreading upwards. It is spread up to your neck. You should go and see a rheumatologist or even a GP if you don't have a rheumatologist nearby yourself. Reason is if your clinical picture fits in with a positive rheumatoid factor, anti-CCP, which is the other factor for rheumatoid, anti-CCP, raised ESR, CRP, then you should be immediately started on drugs which prevent further damage and spread of the disease. Mind you, I would have liked it within the first 2 years. That's why I always say there's a window of opportunity. Within the first 2 years is the best time to put the fire out completely and keep it totally. But still, there's a lot of hope. A lot of drugs have come. Even in delayed stages, 10, 15, 20 years later, we are using something else. But obviously, assessment is very important. And your expectation, what you want to do, and that requires major monitoring and thing. But it should improve. That's my positive thing. If you've gone to the right person, it should improve. No.
In fact, I'm once again repeating doctor's number. He's been kind enough to share it here, 98300428828. You could send him a message and fix an appointment, go and see him. Okay, over to you, Kavita ji, for further questions.
Yes. I'm suffering from SSC limited scleroderma for 10 years. Now it's affecting my feet, sole and elbows. I'm worried. What should I do?
Now, scleroderma is a tricky disease, affects young ladies. I believe you might have had some things like changes of color in the fingers and toes during cold exposure or a direct AC draft or that sort of thing. The thing is, scleroderma is if your fingers, toes, etc., there are disease-modifying agents like methotrexate. Skin ointments can also be given when scleroderma. The skin is important. Initially, they get puffed up. Later, they become paper thin. That is very important. That skin requires checking as well. and try to avoid any sort of vibration as well as cold exposure in the fingers and toes. That needs to be sorted out. And there are other features with limited scleroderma. We have Crest syndrome and other limited things where we check the swallowing, we check the lungs, we check the heart and the other parts, because it's not just joints and skin alone. But important thing is to keep your hands and feet away from cold and vibration. Vibration like you are using a hair dryer. That simple thing can perhaps cause a color change in your fingers called Raynaud's phenomena, and that can also cause a bit of bluishness or a bit of ulceration of the tips of the fingers. So these sort of things, it is very important to see these people and tackle them early, because limited scleroderma, though it says, is from the skin point of view. Your thickening will go up to the elbows in one part. From the toes, it will go up to your knees. That's why it's limited. It doesn't spread to the whole body. But there is something, especially in the heart lungs, which we require to check, which comes with the disease. This is not a specialist. We deal with pulmonary hypertension. They are more to something called pulmonary hypertension. That requires sorting out. And that should be treated. That should be kept under control. There are a lot of drugs which has come out, so don't worry. Is going to see a good rheumatologist, come dermatologist, go. And usually we are friends with both the forums. Let me put it this way.
Next question. Are you comfortable, Dr. Saab? Any break? Any wine break you want to take, sir? Kavita ji, next question.
Yes. I've been getting pain in left heel and it aggravates on certain days and during early mornings. What can I do to prevent? And does walking further increase the problem?
It's the left knee, she said.
Left heel, yes, left heel.
Left heel?
Yes.
Left heel.
The heel is two things I would do. Number one, warm saline foot bath, number one. Number two, do not exercise too much pressure on the heel, at least for 6 weeks. Use a rubber insole of the feet. Insoles can help, soft insoles. Then you can have sport shoes like Nike, etc., at least for 4 to 6 weeks, so it goes away. And you have a mild anti-inflammatory, say naproxen or ibuprofen or something. That should be okay to reduce the inflammation. Within 6 weeks, it should have gone away. If it doesn't go away, then you have to see a doctor properly. Look at other causes of arthritis. Sometimes they can start from the heel. Plantar fasciitis also, your footwear has to be extremely comfortable, both at home as well as in office or your place of work.
Your next question.
Yes. What is seasonal arthritis? When weather changes, then pain in lumbar areas increases. Why is it so?
There's nothing called exactly seasonal arthritis, because we know some viruses become active, like flu and other, etc. And some viruses. You tend to get some arthritis. We have some ones which we call Henoch-Schonlein Purpura, some skin spots coming with joint pains, especially in young kids. They can also happen in adults. They come up in florid red spots of the skin, along with joint pains, usually the ankles or the knees or the feet, and that comes off a particular season. The reason is it's the virus which comes predominantly at that season, so that's why you tend to get it. But there's nothing called seasonal, so you would say, come on, I have a seasonal arthritis at this time of day. Just like seasonal asthma. You understand that, but it's not. It is caused by an organism which is coming at that time.
Next question.
Next question. What can be the remedy for knee pain and tennis elbow?
Obviously, rest, and rest. There's nothing like it, and that's what the COVID is doing for us. But physiotherapy is important. Once the acute pain is gone, you have given the ice packs, etc., then you start doing the statics first, the static exercises with your physiotherapy. Then he can put you through a trained dynamic one. That's what they, both for the knee, the quadriceps exercise and everything can come in. For the hands, also gradual stretches. But 6 weeks later, it should be okay. If not, we can give, rarely, unless the patient is very fussy, an intra-articular or an injection of steroid into the tennis elbow. Even Sachin Tendulkar tried it, but he couldn't get over it. The reason is his cricket bat was too heavy. So he had a perennial load on that hand, so he couldn't get over it. He had to go for something bigger. Okay.
Okay, next. I'm a 63-year-old woman. I have severe pain in backside of the knee, hips, and feet.
Was it answered? Oh, backside of a knee, you said. Okay, I'm sorry. I had to
backside of knee, hips, and feet.
Okay.
These are all weight-bearing joints, so commonly you would expect them to be osteoarthritis. And osteoarthritis means पहले history से शुरू होगी, family history. Number 2, have you got your ideal weight down to ideal weight, which means the dietitian, Hena Nafis and others will be very useful. Then you come down to a little bit of mild anti-inflammatory at that age of 60 plus. Mild ones, I would say, is naproxen, 250. It's cardioprotective. It's less cardiotoxic than other anti-inflammatories. Twice a day for a short period of time, say about 3 to 4 weeks, see how it goes. And then you go into building up your exercises with a trained physiotherapy, quadriceps exercises, hip motions, etc. And that should possibly take care of it. If it doesn't go away, then we are looking at other causes like uric acid, like HLA-B27, which is Ankylosing Spondylitis, gene, that sort of stuff. Other things which are rarer, but it can happen.
Okay.
Next question.
Kavita ji,
okay.
Now let's go for we had an interesting thing yesterday when Miss Hena ji was here. There were like 10, 12 questions lined up, and the answers were definitely may have been bigger. So we started a small session called Rapid Fire. Mm-hmm. So if you can help me in answering them in 1 line or 2 lines, because
that's fine. We'll do it.
We might have another 2.5 hour session with you.
Okay. I'll try to be short. Okay.
Yeah. My 22-year-old daughter complains of a lot of body pain, hands and legs. Vitamin D, calcium, uric acid, everything okay. Can it be a rheumatoid problem? What should we do?
For a rheumatoid problem, you have to have a pain, swelling of the joints with morning stiffness. If that is not there, then you have to put through some physiotherapy. Later on, once the pools swell up with exercise, hydrotherapy, that sort of thing.
Perfect. Next question. What precautions should I run? Sorry, did I interrupt?
Yes, please. You repeat the question, please.
Okay. Next is, what precautions should a runner follow to minimize their knee damage and other injuries?
The point is, they always have to build up their stamina over a period of time. So I'm sure the physiotherapy, the massage which goes into them, along with the special footwear. All these Olympic athletes, I mean national athletes, they're using the best footwear possible. Secondly, it's building up with the hamstring, quadriceps exercise, calf muscle exercise, bringing up your strength so that goes. And paripasu with the improvement in exercise tolerance, which you have with the running.
Perfect. The next question is abnormal growth of any bone a sign of rheumatism?
Yes, it can happen. It can happen, especially in juvenile arthritis below 16 years when our child gets it. Some of the bones, when there's increased vascularity in the bone, that bone tends to shoot up. So it can cause both sometimes a deficit and sometimes an increase, depending on the blood vessel supply during a certain span of their life. If it's excessive blood supply, you tend to grow taller. If it's less, it tends to grow down. Yeah.
My husband is having unexplained body pain and weakness from the last 5 years. He lost 15 kgs weight in these years. Nothing is diagnosed. Can this be rheumatism?
What is his body weight now? That's the next question. After losing 15 kgs, what is his exact body weight he's suffering from?
Incomplete question. So let's skip the question.
Skip the question, please.
I am following healthy lifestyle after diagnosis with rheumatoid, rheumatoid arthritis. In short, it is painful to live with it, but now it is a habit. How to decrease my left foot sole as shooting pain many times during the day. Very painful in winter.
Rheumatoid absolute control is essential. Rheumatoid can cause nerve damage, isolated patches of nerve damage. You have to make sure. Number two is you can, besides control of rheumatoid, there are good nerve painkillers like pregabalin, gabapentin, which can help you during these bouts of severe nerve pain. And I'm sure most of us will prescribe. And most important is to look into why you're getting this nerve pain. And we have good treatment of rheumatoid. Rheumatoid, we're not worried. Even if it's 25 years of illness, we would be able to treat it somehow. We can't prevent permanently, but at least whatever existing, we'll try to stop.
Good. The nail of my thumb of right foot gets detached in a couple of months. This has happened nearly 4 times in last 1.5 years. Is it related to any fungal infection or diabetics? This is nothing to do with this subject, is it?
No, it's most likely fungal infection where the nails tend to peel off, or it could be bad psoriasis. Bad psoriasis, you can get nails peeling off, popping off. Oh my God, it's a part of psoriasis. So it'd be having some pitting of the nails, as if some septic pin has been put on your nail, you can say. Sometimes the nails can become deformed. With thickening of the nails, they become white, and sometimes they can fall off. But fungal infection is more likely, to be honest.
Perfect. So we are 1.5 hours into the session already. Kavita ji, you have to sum it up now. Quick questions to finish it off. Otherwise, you're holding on to it.
Okay. What is frozen shoulder and what is the treatment for it?
Frozen shoulder, in other words, is adhesive capsulitis. There are 3 stages of it. One is when the movement is going down, the pain is very acute. We call it the freezing stage. The next stage is when you can't move your hand. It's frozen really, but the pain is less. Last is your recovery phase of the thawing stage. Important is some secondary factors. Control of diabetes is very important because that sometimes causes frozen shoulder. You have to go through a graded period of exercise through a very trained physiotherapist. If it fails completely, then you perhaps have to go for arthroscopic surgery.
Whose phone is it? Okay.
Okay.
Yeah, that's
Okay.
fine. The next question, Kavita ji.
Yes. What precautions a RA patient in particular should take for COVID-19 as RA is autoimmune disease and low immune is not good at present situation?
There are a good thing and a bad thing. If you hopefully you're not getting a COVID, contracting a COVID. And one of the drugs we use is hydroxychloroquine, which is a hot demand everywhere. Brazil, USA, Donald Trump, everybody has asked for it. So if you're on hydroxychloroquine, that's partially protected. Do not change your medication at all. Only thing, if you're on a bit of steroid, try to cut it down to a minimum, but try to stick to it. If you have COVID, asymptomatic COVID, most of us will be asymptomatic, 80%, then you just stick to hydroxychloroquine and sulfasalazine, nothing else. And if somebody is really into COVID, which means the intensive care unit, then maybe hydroxychloroquine and the drug of choice nowadays, many things have come. One good anti-rheumatoid drug works well, which has been proved. It's expensive one, a Japanese one called tocilizumab, produced, and it's a brilliant drug, but expensive one. But it does work in rheumatoid. It also works in COVID.
Okay. Any more questions left?
Yeah. I have little pain in joints, at times muscular pain in the body. Does it indicate rheumatoid disorder?
Not really. Rheumatoid, they have to have what is called those classical joint swelling, pain, early morning stiffness, your blood parameters, 80% will show a positive rheumatoid factor or anti-CCP, a raised ESR-CRP, and the ultrasonologist will say, come on, your joints are on fire, it will show synovitis. Or if you have the money in the world, you can go for an MRI that will show early joint damage. That's rheumatoid. And common in ladies, but it can happen in men as well after 50. So it's not that we are immune to it, no way.
Okay, are you done, Kavita ji?
There's just one more question again. Further to my left heel pain, I'm also getting pain in right hip and side of right leg, which seems like sciatica. What precautions should I take?
Sciatica is a common term which is the coming out of the disc problem, collapsing on the nerves causing it. But I would also like to rule out something called spondyloarthropathy or Angspond, because the heel and the hip, opposite side, asymmetrical. I would like to think of rule the arthritis out from my part. But that's very simply done by a combo of us, the rheumatologists, sometimes go to neuro. They will do a disc, they will do a lumbar MRI and see, come on, this is your disc causing problem. But they should do your sacroiliac MRI as well. You understand that if it's a rheumatology problem, SI is more important. If it's a lumbar disc problem, the lumbar spine itself is more important. Sure.
The summary of today's session is, you know what, that all the diseases that you're mentioning, I can't even pronounce them.
Chalo, theek hai. You can send them to me. The most important thing is fresh air. Thanks to COVID, we are getting rid of the air pollution. That's the good thing. And hydroxychloroquine from rheumatoid has become a hot demand. It is getting some dollars from abroad, I'm sure, which is good for a foreign exchange. And hopefully life will go on and we'll have the yoga and etc., which is helped us.
You won't believe, Dr. Saab, what I feel is that generally we feel that all the doctors have a special class for handwriting, which only they understand and these chemist shops understand. Nobody else understands. Likewise, your subject is such that you pick up all the difficult names and put them into your chapter. I can't pronounce any of them.
Oh, thank you. But you conducted it so well, let me tell you.
Really? Thank you so much.
Really required, not at all.
There
are more questions?
Yeah,
we have to close it because Dr. Saab has to go. I requested him for 1 hour. It's been over 1 hour and 40 minutes already. Can we sum it up fast, Kavita ji? Not 2 minutes.
Okay.
Yeah.
Taking a glass of milk every day is really bad for bones.
Bones?
Bones.
Who told you, huh? For? Bones?
Yeah.
Bones.
It's brilliant.
Calcium.
You have calcium, you have the vitamin D, irrespective of whether you are veg or a non-veg. Secondly, it calms you down. Secondly, let me tell you that lactose in milk, if you can tolerate it, it breaks up into glucose and galactose is brilliant for the brain. So you get all brainy people drinking milk unless they're milk intolerant or having some products of it, yogurt, paneer, whatever you want.
Neeraj Gupta, are you there? You want to ask a question directly? You had tried to come in. We could not unmute you. Okay, let me try and unmute you there. Just let me unmute.
He's saying that due to some reason he is not being able to.
So
he's again.
You can talk. Neeraj, you can talk. कहाँ चले गए यार? उनका हो नहीं रहा है.
Wait.
Yeah, that's what. Should I just ask the question?
Yes, please ask.
Yeah, can you hear me?
Yeah.
Hello, doctor. Thank you for being on the show. My wife is 48 years old and she had a hysterectomy about 2 years ago. And she's on thyroid medicines and she's taking shell cal regularly. And her main problem is she's having a lower back pain and a tremendous pain in the calf muscles on her lower legs. And it tends to be better when she rests. And and she's also developed this suddenly a milk allergy for the last 2 years. And also developed a tremor in one of her hands. She's on psychotic medicines for almost 10 to 12 years.
The important thing, she will require a calcium, magnesium, phosphate, all important because she has been on some psychotic medicines.
So
she will be requiring not only an X-ray, a digital X-ray of the dorsolateral spine, the lower back,
okay,
but should require a bone mineral density scan. Most likely she will be fairly osteoporotic. Reason is the history of medicines, plus she has stopped a period for 2 years. And if she's osteoporotic, we can definitely start. We have a lot of choices now. One group is called bisphosphonate, weekly tablet or a monthly tablet or a yearly infusion. Second group for osteoporosis is we have subcut injections every 6 months called denosumab. And the third one, which we use rather rarely, unless it's absolutely brittle bones, teriparatide to build up bones, which orthopedic surgeons use in case of fracture for a quick healing of bone. So you have a lot of choices. So we have to have a good look at the spine. Plus, because of a drug history and a recent menopause 2 years ago, we have to treat those deficiencies. And I believe definitely there will be a problem in a bone problem.
So should I show her to a rheumatologist like you, sir, or?
Yeah, you can come over to us if you feel, or any rheumatologist close to your place. We will do the initial screening, and then we will put her on the drugs which saves both the muscle pain, bone pain, and improves the quality of bone. Let me tell you. Now, let me warn you one thing regarding osteoporosis. Post-menopausal osteoporosis, immediately after stoppage of periods, either naturally or the hysterectomy and the ovary removal done by the gynae, the first 5 months, 5 years is very vital, because ladies tend to lose 20% of the bone mass. This is called post-menopausal osteoporosis. That has to be prevented as much as possible. And now she's in that phase. 2 years have gone by.
She's also taking the hormone replacement tablets, sir.
HRT is fine, but definitely that should help her. But we'll be looking at the degree of osteoporosis that she has, because it depends on the quality, and also doing the other factors like magnesium, other things, which can be deficient in people on long-term antipsychotics. Okay?
Right. Thank you so much, sir. Thank you.
Thank you.
Thank you, Dr. Sir. It was a wonderful session today. আর খুব শিখলাম নতুন শব্দগুলো লিখে রাখবো and try to memorize it and come back to you better.
Dekho, one thing we know very little, but we try to make something more complex so that people have a wrong understanding.
Try to more learn it. Thank you. It was such a wonderful. And in fact, I must tell you, Dr. Ray, your wife, Nandini Ray, Dr. Nandini Ray, she was also very, very good here just 3-4 days ago.
Oh, she's better to me by far, let me tell you.
No, but she explained so many things, and her theory of 20-20-20, I keep applying every day. 20 minutes, 20 seconds, and 20 blinks. That's what I keep doing. Okay. Thank you, Ravi, for helping me. Thank you, Kavita, for helping me. Thank you, Hemant. And thank you, Dr. Saab. It was such a wonderful session.
And thanks you and your team. They have coordinated so well, and thanks for bearing with me for 1.5 hours.
Thank you so much.
Thank you.
Thank you, friends, for being here. Come back again tomorrow for Ajay Arya show. Thank you, Sam.
Thank you.